8 Eastern Cape clinics and 2 hospitals are to be demolished and rebuilt. This follows a report by the advocacy groups Section 27 and the Treatment Action Campaign that described provincial health system there as broken, inhumane and collapsed, where accountability is non-existent. At the same time, it's been revealed that more than 4,000 HIV/AIDS patients have defaulted on their antiretroviral ARV treatment in Gauteng since 2010, I think. To talk more about these challenges, we're now joined by Health Minister Dr. Aaron Motsoaledi. Thank you very much for joining us on the program, Minister. Welcome to you.
Thank you.
Let's start in the Eastern Cape. This is a region that you as a national department were looking at anyway. This advocacy group, Section 27 and TAC, they've described what they've seen as broken, inhumane and collapsed, where accountability is non-existent. Is that what you found as well?
Yeah, in most cases, yes. And we started finding out long before they came on board. The pronouncements about the 8 clinics, 2 hospitals, etc., that means the whole infrastructure which I announced last week is something that started 18 months ago. It couldn't have started 2 weeks ago when these issues were shown by the coalition. In other words, we've been aware, that's why, of them as far back as then. That's why when we piloted for NHI, we chose specifically that OR Tambo district as a pilot, because we knew of the challenges of infrastructure, human resources, ambulances, roads, etc. And we said, let's pilot NHI here because it will give it the benefit of quite a number of changes. And so we knew that what must be demolished, because for the past 18 months, engineers have been working in that area, looking at this infrastructure, looking at each of the 197 health facilities in that OR Tambo region.
Would you agree that it's going to take much more than just buildings to fix the system in the Eastern Cape?
Absolutely, absolutely.
So what needs to happen?
That's why you must look at it holistically. I just mentioned building because you mentioned it.
Yes, sure.
Yes. When we piloted NHI, we looked at 5 things and said if these 5 were to happen in the pilot districts and subsequently everywhere throughout the healthcare system, then there will be massive improvements. The first thing is infrastructure. The infrastructure is not only buildings. It also includes equipment, it includes information technology, it includes other forms of technology that are important to the healthcare system. The second thing is the human resources. That's number 2, that we are looking at using a new system called WISEN, which was never there before. It's a new formula of human resource provisioning, a new formula by the World Organization, different from the population-based figures. The third is the quality of healthcare as defined by the 6 basic standards. And the 6 basic standards being the cleanliness of the institution, the infection control in the institution, the attitude of staff, which has been in the news quite often, the safety and security of staff and patients, the waiting times, which was also in the news, and the drug stock outs, which is also mentioned all the time. So we also have plans about that. The fourth is the re-engineering of primary health care to make health care much more affordable, but to take it right to the bottom, not start at the top. And in this case, we have got 3 streams of primary health care: the school health system, the municipal ward-based primary health care agents in the wards, and the specialist teams. And lastly, the contracting of private GPs into each and every one of the rural clinics.
Unfortunately, we don't have too much time, so I'm going to hurry us along a little bit. The NHI is a national program. And I'm just wondering, we're focusing on the Eastern Cape, but have you found other failings in other provinces that you're already sort of on your radar and starting to fix?
Oh, yes. Oh, yes. The infrastructure program which I've unveiled for Eastern Cape, we also have plans for all the pilot districts, especially the areas which were former homelands, the areas which were former Bandustans, because that's where the problems are. That's why it's OR Tambo in the Eastern Cape. That's why it is a Vembe district in Limpopo. We've got Gertsibande in Mpumalanga, We've got Thaba Mofutshanyane in the Free State. Those are the ones where we've completed. We know exactly what the infrastructure look like, and definitely it doesn't look good.
Okay.
Except that OR Tambo is the worst of them all.
All right. So, Gauteng, how is it that 4,410 people are not taking their ARVs?
Well, Peter, I don't know how that was calculated, but let's be fair. We're running the biggest program anywhere in the world. 2.1 million people on treatment every single month. There's no country anywhere in the world that has got that number of people. Time and again, you will experience problems of logistics, of human beings. The issue of compliance on treatment, especially on long treatment, has always been there in medicine. That's why in diseases like TB, over the ages, we have got things like dot support, directly observed treatment options, because they knew that sometimes people stop complying if the treatment is long-term. So one will look at the 4,000 as a percentage of the 2.1 million and see what do we do to reduce even that percentage so that it doesn't exist. But I don't want every time that when we get problems with this massive program, then we believe that everything is falling apart, because there have to be logistical problem.
Well, they talk about, you talk about compliance, and they talk about things like discrimination, denial, stigma. Are we still dealing with issues like that in 2013?
Worldwide, yes. If you look at the report that is still going to United Nations, it's exactly about those. Not for South Africa, for the whole country, to report about those. If you look at our National Strategic Plan up to 2016, it is still talking about those. But lastly, Peter, one of the reasons why we introduced FDCs, the fixed dose combination, is to reduce the level of non-compliance. Because some people non-comply because they have to take 3 tablets 3 times a day, and they just get tired. So if they were to take one in 24 hours, it will become much better. And it's the reason why we are, we've introduced this.
Okay.
Yes.
Perhaps finally, Minister, the NHI program is many years away still. You're in pilot phase. What are people, let's give them a timeline, people at home now, in the Eastern Cape in particular, how quickly can they start to see an improvement in their healthcare system?
Well, some of the things will happen very fast. It's difficult to say, but for instance, the infrastructure plan that we've unveiled, I've unveiled last week, is even indicated the time at which people are going on site. And I've even said, for instance, the clinics where we are going to give them park homes, 4 of them have already got them. So those are already seeing a change. But the others are aware that changes are in the pipeline.
All right, Minister, we certainly wish you the best of luck, because this is something that affects us all. And thank you very much. And we hope that your hand heals quickly.
Oh, in 8 days' time, I'll have removed this. Yes.
Thank you very much indeed. Right. That was the Health Minister, Dr. Aaron Motsoaledi, speaking to us and promising us that things are changing. In fact, some successes have already been noted in some provinces.